Welcome to Discount Benefit Solutions webinar on nonprofit organizations, Part 2. The topics for today's webinar include discussing how nonprofits differ from independent sales reps, reviewing nonprofit literature that is available to our sales reps, which includes a proposal document, a follow-up email/letter. Also, we will be providing an overview on commissions that can be earned and the bonus available to independent sales reps who sign up nonprofits. And lastly, we will be reviewing the donations that nonprofits earn on commissionable claims and what they receive when they sign up to distribute cards. Signing up a nonprofit versus an ISR. How does signing up a nonprofit differ from an independent sales rep? Since a nonprofit is considered a different type of entity from that of an ISR, there are a few key differences when signing them up as a distributor. First, commission amounts differ for the independent sales rep. This will be explained later on in the presentation. Second, instead of customer acquisition bonuses, the independent sales rep receives a $200 bonus once the nonprofit generates 100 commissionable claims. And third, nonprofits receive donations on commissionable claims. Please use the term donation when speaking with nonprofits instead of the term commission, as nonprofits prefer to not speak of revenue earned, but rather donations that can be earned, which benefit their mission in the community in which they serve. There's various literature that's available regarding nonprofits, and FreeRxPlus has developed documents that can be used when reaching out to nonprofits. First is a proposal document. This document serves as a customizable document that can be modified to fit the needs of the nonprofit. It outlines the FreeRxPlus program, its product offering, benefits associated with distributing cards, an opportunity analysis, a chart outlining examples of prescription savings across several states, an implementation strategy, and much more. So let's take a look at the nonprofit proposal document together. Right now, we're taking a look at the proposal document that you would prepare and thus present to the nonprofit organization that you're reaching out to. As you can see, it has that the proposal has been prepared for the organization name. This is where you would put in the nonprofit that you're reaching out to's name. At the bottom, it says presented by the independent sales rep. This is where you would put in your name and you would modify the date so that it matches whatever month and year you are meeting with the nonprofit. The next page has a program overview, which just basically proposes the valuable opportunity to the organization, its staff, volunteers, supporters, and community. You'll notice that throughout this document, there is organization name is called out and it's italicized. This simply represents where you would put in the specific nonprofit that you're reaching out to. Under the program overview, we call out that our prescription discount card helps those in need save up to 75% on their prescriptions at over 54,000 pharmacies nationwide. Next, you can see that we have the benefits to the nonprofit, and we outline the various benefits. That it creates a significant and recurring stream of donations. The prescription discount card would reward their staff, volunteers, supporters, and the community with substantial savings. And it increases the exposure of their mission and builds loyalty. The next section of the document contains opportunity analysis information. So the nonprofit comes into contact daily with people across the nation who have no prescription benefit programs and that may be paying full price for prescriptions at their pharmacy. We provide some facts around drug costs and how they're the fastest growing component of healthcare. We also mention what the donation will receive in the terms of a donation onward every time that the card is used, and they'll receive a $1 donation that's called out here. And we also call out that the organization can print and distribute cards as rewards for certain promotional activities and events. And then donations will increase exponentially as more cards are distributed and used. The bottom paragraph, we say that since there are no forms to complete and there's no membership to join, every card printed will have the same group and member ID number. This is a unique concept that simplifies administration of the program and significantly reduces the printing costs of the cards. Each card can be used many times, and the individual simply just has to visit your co-branded website and can also print a card there by going to your website. On the next page, the program objectives section calls out that the organization, the nonprofit that you're reaching out to, their prescription discount card will provide significant relief from the rising healthcare costs. In addition, the discount card will provide a new and potentially significant source of ongoing donations for them. We also include in here target demographic section, where we say that this program is ideal for all uninsured and underinsured individuals, as well as those with high deductible health plans and other types of insurance. There is no exclusion, and all printed cards are active and ready for use. The second target audience for the FreeRxPlus.com prescription discount card is the Spanish-speaking community. So all program materials as well as customer service is provided in both English and Spanish. Those with insurance who are prescribed medications that are excluded from their coverage can also use the FreeRxPlus prescription discount card. The program was developed as a win-win proposition. The cardholder wins as they will receive significant savings on their pharmacy purchases, and the nonprofit wins as they receive a donation each time a consumer uses a card. The program implementation. So this is where you would explain to the nonprofit how this is going to be rolled out. So the cost to the organization, we provide several facts. We say that FreeRx Plus will waive all setup fees for the nonprofit and will provide them with a co-branded website for the nonprofit to link to, as well as display on their card at no cost. FreeRx Plus will customize the nonprofit's prescription discount card to include the organization's logo at zero cost. FreeRx Plus will also provide co-branded informational flyers as well as work with the nonprofit on a press release at no cost. And last but not least, FreeRx Plus will provide the first 1,000 prescription discount cards at no upfront cost to the nonprofit. The recommended launch strategy is a phased approach. FreeRx Plus will suggest that a general announcement to all nonprofit volunteers and employees goes out in phase 1. This announcement could be in the form of a flyer inserted within communications that are mailed out or handed out. It could be inside paychecks for the staff members, posting materials throughout their location, as well as management announcements. The first week the program becomes available, supervisors will speak with everyone and post information for awareness. Volunteers and employees will not only be the first to test our program, but they will also tell their friends and families about the savings they are receiving. In phase 2, FreeRx Plus suggests that promotional materials be placed in the nonprofit's public areas, so visitors have visibility and access to the program. Small card displays in the public areas will offer the nonprofit prescription discount card to take away during their visit. A mailing tailored to the launch of the prescription savings program should be mailed to existing supporters and other lists as a way to offer a resource to the community during the tough economical times, and would thus generate donations for the nonprofit. In Phase 3, FreeRxPlus.com further suggests that the nonprofit works with their supporting organizations to provide prescription discount cards to all customers shopping at the supporting organizations. For example, one supporter downtown has a stationery and office supply business and would be more than willing to place a small display with cards in their location to help support the nonprofit. The corporate staff of FreeRxPlus.com has extensive experience developing effective and appropriate marketing strategies tailored to each specific program. Our team will be available before, after, and throughout the program development to provide the necessary materials for success. The next section of the proposal document goes into the proposed program components, which include donation notification, employee and supporter email blasts, existing supporter and previous adopter database mailings, banner ads on the website, press releases, and location signage. The next section covers the prescription savings cards themselves. And here is where we have an example of what the prescription card looks like. We explain it, and then we go into some financial projections. So the estimated donation model for the nonprofit that you're reaching out to. Annual transactions for nonprofits are approximately 50,000. So per script transaction donation would be $1 because that's the donation that they earn on each commissionable claim. Therefore, if they did 50 transactions, their annual residual donation would be equivalent to $50,000. Program support. For any consumer questions, a bilingual toll-free 1-800 number is provided for all customers. The nonprofit staff can refer any questions to the 1-800 number printed on the FreeRx Plus prescription discount card. Our customer service offers unparalleled service and is available to answer calls 24 hours a day, 365 days a year. Additional program training that FreeRx Plus will provide includes sample emails and letters for introducing the program, web presentations to key personnel, implementation support. And you can see in here we have included a chart with sample savings from different pharmacies across various states. And you can see that we included the prescription name, the cost, what the member paid, their savings, and then the percentage of savings. And this is very helpful when presenting to the nonprofit because it gives them an example of the significant savings that those that they are assisting in the community can receive. So that concludes the proposal document. You'll see at the very end, the page that we're looking at right now, you would put for more information, please contact the independent sales rep. So this is where you would put your name, your email address, your telephone number, if you have a toll-free number or a fax number that you would include, as well as your address information and your FreeRx Plus website with your group number so that anytime your cards are out there, they are going to your particular website to print out a card. The second document that we're going to be looking at today is the follow-up letter, and this can be sent to nonprofits after your initial meeting with them. This will nurture the nonprofit organization by providing a professional follow-up that reinforces why they need the FreeRx Plus card and the benefits of signing up to become a distributor. So let's take a look at the follow-up letter together. So right now we're going to take a look at the nonprofit follow-up letter that you can send out via postal mail or email. This will simply thank the nonprofit for taking the time out to meet with you. And you will personalize it to them. So this is a template that you can use when following up with them. So you can say something like, as we discussed during our call or in person, FreeRx Plus has partnered with many nonprofit organizations since 2009 and has been helping them generate new and ongoing donations without selling anything or asking for contributions. Our program provides a prescription discount benefit at no cost to your organization or members of your community. A large majority of people either have no prescription benefit coverage or they have very high copays. FreeRx Plus provides a free solution to this problem. FreeRx Plus is a prescription discount card that is custom branded for, and this is where you would put in the nonprofit organization's name. There is no cost to use the card. Anyone can use it, whether they are uninsured or have a prescription plan with a high copay or have a high deductible health plan. Our program is quite simple. We design and provide you with FreeRx Plus prescription discount cards for distribution to the community, your donors, and your members. The card is free to use and offers significant savings off of most FDA-approved drugs, with savings as high as 75% off the retail price. The savings are dramatic and at a time when people really need the help. Since the inception of our program, we have saved users of the card over $150 million. We will continue to see the number of card users increase significantly as many of the new health plans currently being sold have very high prescription deductibles. The prescription discount cards can be physically given out at events, mailed, or emailed to your existing database of donors and members. The nonprofit will have a customized link to place on your website so that if anyone misplaces their card, they can simply print another card right from your website. The card is active the moment they receive it and can be shared with the entire family. There is no need for registration and no personal information is collected. Our graphic designers will create your branded cards and customize marketing pieces for you at no cost, and we will assist you in creating ways to distribute the cards. Each time the card is used for a discount on a medication, the nonprofit will receive $1. While $1 may not sound substantial, in reality it is. There were over 4 billion prescriptions filled last year in the US, and the number continues to grow. We currently have organizations bringing in a significant amount of revenue each month. FreeRx Plus offers you a program that will allow you to provide a free prescription discount benefit to your community that costs nothing to use. The program will generate new and ongoing donations for your organization without having to ask your donors or members for more money. What could be easier than saying, if the card saves you money at the pharmacy, use it, and the nonprofit will get $1 for each prescription filled that saves you money. The next slide, we're going to cover the summary of nonprofit offerings. So the nonprofit entity will receive $1 for each commissionable claim. There is no setup fee for the nonprofit to join FreeRx Plus, and FreeRx Plus will cover the costs of designing their cards and marketing materials, as well as the cost of their first batch of cards. The nonprofit will receive 1,000 glossy FreeRx Plus prescription discount cards at no charge. Instead of the customer acquisition bonuses for nonprofits, since they are a different type of entity than that of an ISR, the ISR sponsoring the nonprofit, that's you, earns $200 once the nonprofit is implemented and generates 100 commissionable RX claims. The first 100 claims that the nonprofit generates will not be commissionable to the nonprofit, but will be commissionable to you at $2 per claim for a total of $200. Once the nonprofit generates 100 claims, they will receive $1 per commissionable claim, and you will earn a 40-cent override. To locate the nonprofit literature that was discussed today, you can log into your e-business suite and click on Marketing Tools. The nonprofit proposal document, as well as the follow-up letter or email, are going to be stored under the Nonprofit Toolkit section. Lend a helping hand. Reach out to nonprofits today and help spread the word on the FreeRx Plus prescription savings program. Help those who are struggling to pay for their prescriptions and earn residual income for your family. Feel free to contact us with any questions at info@freerxplus.com or call us toll free at 1-888-412-0869. Remember, if you would like us to support you on a call with a nonprofit, please let us know, and we would be more than happy to assist you in closing the deal. We ask that you give us at least 3 days notice so we can have someone assist you. Thank you.